Level 1. The Claims Data Entry Processor. Speaking slowly. Calm. You sit at a desk you share with someone you have never met. Speaking slowly. Serious. They work the night shift. You work mornings. Speaking slowly. Serious. Sighs. By the time you arrive, their chair is still warm. You do not know their name. Storytelling. Serious. There is no reason to. Storytelling. Serious. Your screen turns on. There is a queue. Speaking slowly. Serious. 300 items by end of day. Speaking slowly. Serious. Each item is a claim. Somewhere a person went to a doctor. Speaking slowly. Serious. Or a hospital. Or a pharmacy. Storytelling. Serious. They received care, or they attempted to. They signed a form, or their provider signed one on their behalf. Speaking slowly. Serious. That form has traveled through several systems before it arrives on your screen. Speaking slowly. Curious. You do not see the form. You see a number. Speaking slowly. Serious. You see a code. Speaking slowly. Serious. The International Classification of Diseases, 10th revision. Speaking slowly. Serious. More than 70,000 diagnostic codes. MM 79.3 is pain in the heel. Storytelling. Serious. C34.12 is secondary malignant neoplasm of the upper lobe of the right lung. J18.9 is pneumonia, unspecified organism. Storytelling. Serious. You do not need to know what any of these mean. Speaking slowly. Arius. You need to enter the right code into the right field. Then you click Submit. Speaking slowly. Calm. Then you move to the next one. Speaking slowly. Arius. This job does not require a medical degree. It does not require a college degree. Storytelling. Serious. It requires a high school diploma and 4 to 6 weeks of training. You finished in 5 weeks. Storytelling. Serious. You are 24 years old. This is your first job with full benefits. Speaking slowly. Serious. You have health insurance now. You are covered. Speaking slowly. Serious. You enter claim number 1. The code matches the allowed list. Speaking slowly. Calm. You click Submit. The claim disappears from your queue. Speaking slowly. Serious. Sighs. You do not know where it goes. That is not your role. Speaking slowly. Serious. Claim number 2. You have not seen this code before. Speaking slowly. Calm. You open the lookup table. You search. Speaking slowly. Calm. You find it. You enter it. Speaking slowly. Serious. Submit. Speaking slowly. Serious. Claim 3. Claim 4. Speaking slowly. Serious. Claim 12. Storytelling. Serious. By 10 in the morning, you have processed 73 claims. You take a coffee break. Storytelling. Serious. The queue shows 227 remaining. Storytelling. Serious. Here is the thing no one tells you on your first day. Every time you enter a code and click Submit, something happens to someone, somewhere. Not always. Storytelling. Dramatic. Not immediately. But the code you just entered will determine whether this claim is reviewed, denied, approved, or sent back requesting additional documentation. Speaking slowly. Serious. You are the first step. Storytelling. Serious. Sighs. You do not know what the second step looks like. Storytelling. Serious. The person next to you has worked here for 3 years. You ask her whether there is any way to know what the codes actually lead to. Conversational, serious. She says, "That is not our job to know." She says, "Just enter them correctly." Speaking slowly. Serious. By 5 in the afternoon, you have processed 311 claims. Speaking slowly. Serious. 311 people are waiting. Speaking slowly. Trained? Sighs. You do not know the name of a single one of them. Speaking slowly. Serious. The claim moves up the chain. Someone reviews it. Speaking slowly. Serious. Not a doctor. An adjuster. Level 2. The claims adjuster. Speaking slowly. Serious. You do not need a medical degree for this job. Speaking slowly. Serious. 4 to 6 weeks of training. A manual on coverage criteria. Speaking slowly. Serious. A screen full of claims flagged for review. Speaking slowly. Serious. The claim arrives from the processor below. It has been coded. Speaking slowly. Serious. It is your job to match it against the guidelines, not to evaluate it medically. Speaking slowly. Serious. To compare it. Storytelling. Serious. The guideline says, Procedure A is covered if the diagnosis code is X, Y, or Z. This claim carries code W, speaking slowly, serious. Code W is not on the permitted list. Speaking slowly. Dramatic. You click. Deny. Storytelling. Serious. Sighs. You do not know what code W represents. It does not matter. Speaking slowly. Serious. The list does not include W. The decision is clear. Storytelling. Serious. This is not a judgment call. It is a matching problem. Speaking slowly. Serious. That is the design. Storytelling. Dramatic. Last year, according to the Kaiser Family Foundation, 1 in 5 claims submitted through ACA marketplace plans was denied. You are part of that mechanism. Speaking slowly. Serious. Not the only part, but a part. Speaking slowly. Serious. Your performance review tracks several things. Processing speed. Speaking slowly. Serious. Accuracy rate. And something else. Denial rate. Speaking slowly, authoritative. It is not called a quota, the company does not use that word. There are benchmarks. Storytelling, authoritative. There are expectations. People who consistently fall outside the benchmark in one direction have conversations with supervisors. Storytelling, serious. At 4:47 on a Tuesday afternoon, there is a claim on your screen. A gynecological procedure has already been performed. Speaking slowly. Serious. The diagnosis code matches the allowed list, but the provider is not in the network. Speaking slowly. Dramatic. Out of network. Deny. Storytelling. Serious. Sighs. You do not know whether the patient was aware the provider was out of network when they scheduled the appointment. Sometimes people do not check. Storytelling. Serious. Sometimes they check and receive incorrect information. Sometimes the network listing has not been updated. Speaking slowly. Serious. It does not change the decision. Out of network is out of network. Speaking slowly. Dramatic. Deny. Speaking slowly. Serious. 6 claims remain before the queue is clear. Storytelling. Dramatic. Here is something you were not told in training. Only 0.2% of all denied claims on ACA marketplace plans are ever appealed. According to KFF data from 2024, that is the figure. Speaking slowly. Serious. 0.2%. Speaking slowly, dramatic. And of the people who do appeal, more than 40% win. Speaking slowly. Serious. 40%. Storytelling, dramatic. That means more than 40% of the deny decisions made by adjusters like you are reversed when patients fight back, when they fill out the forms. Speaking slowly or serious. When they send the letters, when they refuse to accept the first answer. Speaking slowly. Serious. But 99.8% do not fight back. Speaking slowly. Serious. The system knows this number. The system was built around this number. Speaking truly. Serious. Claim number 312 is waiting on your screen. Speaking slowly. Dramatic. Above you, someone reviews the appeals. That person has a title. Speaking slowly. Serious. Their title includes the word nurse. Level 3. The prior authorization specialist. Speaking slowly, serious. A doctor has ordered an MRI. Conversational. Serious. Before the MRI can happen, the doctor must ask your permission. Storytelling. Serious. Not yours specifically. Yours, the insurance company, expressed through your job title. Prior authorization specialist. Storytelling. Serious. The person whose job is to review requests for treatment before treatment is allowed to occur. Speaking slowly. Serious. The patient has recurring headaches. 4 weeks of them. Conversational. Serious. The doctor's notes say R5 1.9 headache unspecified. Concern for possible intracranial pathology. Speaking slowly. Serious. Requesting MRI brain without and with contrast. Storytelling. Serious. You open the guidelines. MRI of the brain requires a documented diagnosis or failure of conservative treatment for at least 6 weeks or clear evidence of specific neurological symptoms. Speaking slowly, Grius. The patient has 4 weeks of symptoms. The guideline requires 6. Storytelling, serious. You type. Request does not meet clinical criteria. A 6-week trial of conservative management is required prior to advanced imaging. Conversational, serious. You have never spoken to the patient. You have never spoken to the doctor. Storytelling, serious. This is the job. Storytelling, serious. In 2022, the American Medical Association surveyed physicians about prior authorization. The average doctor spends 13 hours per week completing prior authorization paperwork. Speaking slowly, serious, 13 hours. Nearly 2 full working days. Speaking slowly. Serious. Not treating patients. Requesting permission to treat patients. Speaking slowly. Serious. You do not see that side. You see the request. Speaking slowly. Serious. You apply the criteria. You click. Storytelling, serious. There is something else you do not see. Ghost networks. Storytelling, serious. When patients are told to find an in-network therapist, they use the network directory. The directory lists many names. Storytelling, serious. But according to an investigation by the New York Attorney General, 82% of mental health providers listed as in-network by one major insurer were phantom entries. Providers who had retired. Speaking slowly. Dramatic. Who had died. Who no longer accepted that type of insurance. Speaking slowly. Serious. 82%. Speaking slowly, serious. A patient calls the first number, no longer in practice. Speaking slowly, serious. The second number, No longer accepts this plan. Speaking slowly, serious. The third. A 6-month wait list. Speaking slowly, serious, sighs. You do not know about any of this. The network listing is not your responsibility. Speaking slowly, serious. Your responsibility is prior authorization. Speaking slowly. Dramatic. Request denied. Criteria not met. Conversational, dramatic. 2 weeks later, the doctor calls to appeal. You review it again. Speaking slowly, Arius. The patient has now been in pain for 6 weeks. The criteria are now met. Speaking slowly, dramatic. You approve the appeal. Storytelling, serious, sighs. You do not know that 2 weeks without diagnosis left a different patient's condition untreated. You do not know what the delay cost. Speaking slowly, calm. You moved through the correct steps. The outcome is above your visibility. Speaking slowly. Calm. You open the next request. Storytelling. Serious. The request that matters is not here. It's at the hospital, where a nurse is on the phone, deciding whether a patient can stay 1 more day. Level 4. The Utilization Review Nurse. Speaking slowly. Serious. You are a registered nurse. Storytelling. Dramatic. 7 years in surgical recovery. You know what post-operative infection looks like: the slight discoloration at the incision site, the temperature that is not quite high enough to alarm anyone, but is not quite normal either, the patient who says they feel fine but whose eyes do not. Speaking slowly. Arius. You left the hospital 3 years ago. The pay is 40% higher here. Speaking slowly. Arius. No night shifts, no physical labor. Speaking slowly. Arius. You review files, you make calls. Storytelling. Arius. Your job: determine whether patients currently hospitalized meet the criteria for continued stay. Medical necessity review. Speaking slowly. Serious. Utilization management. Speaking slowly, serious. The guideline for standard hip replacement surgery: 3 days. Speaking slowly, serious. She is 73 years old. She is on day 4. Speaking slowly, serious. The surgical team has flagged the chart. You call the attending physician. Conversational. Dramatic. He says, there are signs consistent with early-stage infection. The patient's status is not fully stable. Speaking slowly. Serious? He would like 1 more day to monitor. Storytelling. Serious. You listen. You understand what he is describing clinically. Storytelling. Dramatic. 7 years in surgical recovery, you have seen what post-operative infections look like when they are caught early and when they are not. You know he may be right. Speaking slowly. Serious. You open the guideline document. Storytelling. Dramatic. Criteria for extended stay following hip replacement. Documented fever above 38.5 degrees Celsius, or confirmed infection indicated by laboratory results, or specific documented complications meeting listed thresholds. Storytelling. Serious. Her temperature is 38.1. Blood work shows slightly elevated markers that do not meet the specified threshold. Speaking slowly. Serious. The criteria are not met. Speaking slowly, serious. You tell the physician the criteria for continued stay are not satisfied. Conversational, serious. You say, discharge today. Storytelling, serious, sighs. There is a pause. He says, understood. Storytelling. Serious. You enter into the system. Continued inpatient stay, not medically necessary per established clinical criteria. Discharge recommended. Speaking slowly. Serious. You did not fabricate the criteria. You did not violate the guidelines. Speaking slowly. Serious. You followed the process correctly. Storytelling. Serious. Here is what the system does not provide you. Outcomes tracking for discharged patients. Storytelling. Dramatic. You will not know whether she was readmitted 2 days later with a systemic infection. You will not know whether her family called an ambulance at 2 in the morning. Storytelling. Dramatic. You will not know whether the infection that her physician thought he was seeing was the infection that became the crisis. Speaking slowly. Serious. That data does not connect to your screen. Storytelling. Serious. Not because no one tracks it, because the tracking does not loop back to the person who made the original decision. Storytelling. Serious. This is not an oversight. It is how the system is structured. Speaking slowly. Calm. You move to the next chart. Speaking slowly. Serious. Above you are people who do not see individual charts. They see rates. Speaking slowly. Authoritative. Percentages. Quarterly trends. Storytelling. Authoritative. They set the targets that shape what decisions look like across hundreds of thousands of cases. Level 5. The Underwriter. Storytelling. Serious. The application arrives. You read it the way a geologist reads rock looking for fractures. Speaking slowly. Serious. Male. 47 years old. Speaking slowly. Serious. History of type 2 diabetes. Hypertension managed with medication. Speaking slowly. Serious. BMI. 31. Speaking slowly. Serious. You open the actuarial model. You input the variables. Speaking slowly. Serious. The model returns. Risk score 7.4. Speaking slowly. Serious. The threshold is 6.0. Above the threshold, the premium tier increases. Storytelling. Serious. This applicant will pay $340 more per month than last year. Speaking slowly. Serious. Sighs. He does not know this number yet. Storytelling. Serious. What you do is price probability. The probability that a person will use medical services. Storytelling. Serious. The probability that they will consume more than they contribute to the pool. This is called risk assessment. Storytelling. Serious. This is what insurance is. Speaking slowly. Serious. This man carries statistically higher risk than average. The model says so. Speaking slowly. Serious. The model was built from millions of data points. The model is usually right. Speaking slowly. Serious. You approve the application. New premium tier. Storytelling. Serious. Not a rejection. The Affordable Care Act does not allow rejection for pre-existing conditions. But no one said anything about the price. Burn slowly. Serious. Next application. Female. Pigsing slowly. Dramatic. 38 years old. Diagnosed with stage 1 breast cancer 3 years ago. Speaking slowly. Serious. Currently in remission. Speaking slowly. Serious. Risk score 9. 2. Speaking slowly. Serious. Highest premium tier. Speaking slowly. Serious. She has been healthy for 3 years. The model sees the history. Storytelling. Serious. The model calculates the probability of recurrence. The model calculates the cost of treatment if recurrence occurs. Speaking slowly. Serious. The model outputs a number. Storytelling. Serious. That number is what you charge. Speaking slowly, serious. You do not dislike her. You do not want her to get sick. Storytelling, serious. You are performing a calculation. The company requires accurate calculations to remain solvent, to pay claims for the people who do get sick, to remain functional as an institution. Storytelling, serious. This is why insurance exists, you know that. Storytelling, serious. But here is what is also true. You are placing a dollar value on a person's access to protection at the moment they are most vulnerable. The sicker you are, the more you pay. Speaking slowly. Serious. The more you need insurance, the more you pay for it. Speaking slowly. Serious. You did not write this rule. You apply it. Speaking slowly. Serious. The model runs. The number appears. Speaking slowly. Calm. You click approve. Speaking slowly, serious. Next application. Storytelling, serious. Above you is someone with a medical degree. They also work for the insurance company. Storytelling, serious. Their role is not what you expect. Level 6. The medical director. Speaking slowly. Serious. Your diploma is on the wall. MD. Speaking slowly. Serious. 7 years of training. Storytelling. Serious. You joined the insurance company 4 years ago. The salary was double what you made in practice. Speaking slowly. Serious. No on-call. No patients arriving at 3 in the morning. Speaking slowly. Serious. No malpractice anxiety that follows you home. Speaking slowly. Serious. Your job. Review coverage denials. Provide medical authority. Speaking slowly. Serious. When the company denies a claim, a physician must sign off. That physician is you. Storytelling. Dramatic. In March 2023, ProPublica published an investigation into a system used by Cigna called PXDX. According to that investigation, Cigna's medical directors denied 300,000 claims in 2 months using this system. Speaking slowly. Serious. Each claim was reviewed for an average of 1.2 seconds. Speaking slowly. Serious. 1.2 seconds. Storytelling, serious. A physician who worked under that system told ProPublica, "We literally click and submit. It takes all of 10 seconds to do 50 at a time." Speaking slowly. Serious. The system queues the claims. A summary screen appears. Speaking slowly. Dramatic. Click deny. Click deny. Speaking slowly. Dramatic. Click deny. No file opened. Speaking slowly. Serious. No patient record reviewed. Storytelling, authoritative. The denial letter goes out. The letter says, "This determination was made following review by a board-certified physician." Speaking slowly. Serious. Both sentences are technically true. Speaking slowly, serious. The physician has the credentials. The claim was reviewed. Storytelling, serious. No letter says the review lasted 1.2 seconds. No letter says the physician did not open the file. Storytelling, serious. This is the value of your medical degree inside this system, not to heal. Speaking slowly. Serious. To provide legal cover. Speaking slowly, serious. The patient receives the letter. They read, "A physician reviewed my case." Storytelling. Serious. They think, "Someone with medical expertise looked at my situation. Someone qualified made this determination." Speaking slowly. Serious. They are not wrong about the first part. Storytelling. Serious. According to Cigna, following the ProPublica investigation, some denials were reversed. A class action lawsuit was filed. Speaking slowly. Serious. The company disputed the characterization. Speaking slowly. Serious. You do not work for Cigna. You work for a different company. Speaking slowly. Serious. Your company does not use the name PXDX. Storytelling. Serious. But you know what your queue looks like at the end of each quarter. You know how many denials need signatures. Speaking slowly. Serious. You know the pace at which they move through. Storytelling. Serious. Here is what the denial letter does not say. The physician who signed it was not your physician, was never assigned to you. Storytelling. Serious has never seen your chart. Their credentials appeared on your paperwork because the system required a credential. Speaking slowly. Serious. The credential was available. Storytelling. Serious. Your medical degree is the machine's most important legal instrument, not because you practice medicine here. Speaking slowly. Serious. Because your presence allows everything else to be described as medical review. Storytelling. Authoritative. The targets that fill your queue did not come from you. They came from someone who has never seen a claim number. Speaking slowly. Serious. They call it medical loss ratio optimization. Level 7, the Vice President of Claims. Speaking slowly. Authoritative. The slide reads, Q3 medical loss ratio, 84.2%. Target, 83.5%. Speaking slowly. Serious. You circle the number. Speaking slowly. Serious. Medical loss ratio, MLR. Storytelling. Authoritative. The rule written into the Affordable Care Act. Insurers must spend at least 80 to 85% of premium revenue on actual care, depending on plan type. The remainder covers administrative costs and profit. Speaking slowly. Serious. That sounds like protection for patients. Storytelling. Authoritative. Here is what it actually does. It fixes the profit ceiling. You cannot earn more than 15 to 20% of premium dollars by keeping them. Storytelling. Serious. So the only growth comes from volume and from optimizing what you spend within that band. Speaking slowly. Headroom, 0.7%. Storytelling. Serious. You ask the team, what is driving the overage? Storytelling. Serious. Someone says, prior authorization approval rates in the oncology category are up 11%. Conversational. Serious. You say, tighten the criteria. Speaking slowly. Dramatic. You do not say, deny cancer treatment. You do not want anyone to suffer. Storytelling. Authoritative. You want the numbers to align with the target. Tighten criteria means raise the clinical necessity threshold. Storytelling. Dramatic. It means require additional documentation before approvals. It means deny initially and require appeals. Speaking slowly. Dramatic. Most will not appeal. Speaking slowly. Serious. You know that number. 0.2%. Speaking slowly. Serious. The system is built on that number. Speaking slowly. Authoritative. Your target cascades downward, to your regional directors. Storytelling. Serious. To supervisors, to the adjusters looking at their queues at 4:47 in the afternoon with 6 claims remaining. Speaking slowly. Authoritative. They do not receive your memo. They receive the new benchmark. Speaking slowly. Authoritative. The benchmark does not explain the reason. The benchmark is simply the new number. Storytelling, dramatic. This is how pressure travels through a system without anyone being able to draw a direct line from decision to consequence. No one told the adjuster to deny more. Speaking slowly, authoritative. The adjuster was told the benchmark changed. The adjuster adjusts, storytelling. Authoritative. According to the Senate Permanent Subcommittee on Investigations Majority Staff Report, published in October 2024, post-acute care denial rates at major Medicare Advantage insurers rose dramatically following the deployment of AI-assisted utilization management tools, in some cases more than doubling in 4 years. Somebody set those targets. Speaking slowly. Serious. Somebody reviewed the numbers and decided the direction was acceptable. Speaking slowly. Serious. You will present this quarter to the C-suite next week. The numbers look manageable. Speaking slowly. Serious. Q4 may improve. Storytelling. Dramatic. You will not be on the call with the CMO about appeals volume. That is a different meeting. Speaking slowly. Authoritative. The CMO handles the congressional questions. The CMO has medical in their title. Speaking slowly. Serious? That is not a coincidence. That is the design. Level 8. The Chief Medical Officer. Conversational. Authoritative. The senator leans forward. Speaking slowly. Serious. She holds a piece of paper. She reads from it. Speaking slowly. Serious. His name was Ravi Coutinho. Storytelling. Serious. According to ProPublica reporting citing family members and court records, Ravi Coutinho needed mental health care. He tried to find a therapist covered by his insurance. Storytelling. Serious. He made 21 phone calls. In each case, the provider had retired, was no longer accepting the plan, or had a wait list measured in months. Storytelling. Dramatic. After multiple hospitalizations related to alcohol dependence and unable to access outpatient care through his network, he died. His mother filed a lawsuit against the insurer in May 2025. Speaking slowly. Serious. The case is pending. Storytelling. Dramatic. The senator asks, the algorithm your company uses to evaluate post-acute care coverage, what is the rate at which its initial denials are overturned on appeal? Storytelling. Serious. You have reviewed the figures. According to the Senate Permanent Subcommittee on Investigations October 2024 Majority Staff Report, United Health's post-acute care denial rate rose from 8.7% to 22.7% in the 4 years following deployment of their AI-assisted tool. Speaking slowly. Dramatic. And when those denials were appealed, 9 out of 10 were reversed. Speaking slowly. Serious. 9 out of 10. Conversational. Serious. You say, we take all matters of patient care seriously. Our utilization management tools are designed to ensure clinical appropriateness. Speaking slowly. Authoritative. They are reviewed by board-certified physicians. Conversational. Dramatic. The senator says, he died before his appeal was processed. Conversational. Serious. You say, we are reviewing our practices continuously. Storytelling. Dramatic. Here is what you do not say at the hearing. In May 2025, The Guardian published an investigation reporting that United Health made payments to nursing homes connected to denials of hospital transfer requests, including for patients requiring emergency care. That investigation concerns a different company from yours. Storytelling. Serious. But you are the medical face of this industry today, sitting in this hearing room, because you are the one with the title that contains the word medical. Speaking slowly. Serious. Your title is not an accident. Storytelling. Serious. Every denial letter that goes out with the phrase reviewed by a physician requires someone with credentials to make that phrase technically accurate. You are that credential. Speaking slowly. Serious. Your role is to be the medical legitimacy that the business model requires. Speaking slowly. Serious. After the hearing, you call the general counsel. Slowly. Serious. The stock dropped 2.3% during your testimony. Speaking slowly. Authoritative. The CEO wants to meet. Level 9. The Chief Executive Officer. Speaking slowly. Authoritative. Your company earned $22 billion in profit last year. Speaking slowly. Dramatic. 1 in 5 claims filed in your network was denied. Speaking slowly. Serious. You are ranked 3rd in the Fortune 500, behind Walmart. Storytelling. Serious. Behind Amazon. Ahead of every hospital system, every pharmaceutical company, every other entity in American healthcare. Storytelling. Serious. 50 million people depend on decisions made inside this organization. None of them voted for you. Speaking slowly. Authoritative. None of them can remove you. Only the board can. Speaking slowly. Authoritative. The board is satisfied. The stock is performing. Speaking slowly. Authoritative. Quarterly earnings are aligned with guidance. Storytelling. Serious. You are the most powerful person in American healthcare. Your policy decisions affect more lives than any single physician, any hospital, any piece of legislation passed in the last decade. Speaking slowly. Serious. Doctors treat the patients who are approved. Your company decides who is approved. Storytelling. Dramatic. On December 4th, 2024, the Chief Executive Officer of the largest health insurance company in America was shot and killed outside a hotel in Manhattan. This is a verified fact, reported by Reuters, the Associated Press, and CNN. Speaking slowly. Serious. The public response was not grief. Storytelling. Dramatic. In the hours that followed, millions of people posted about their own denied claims, about parents who could not get coverage. Storytelling. Dramatic. About appeals that were lost, about hospitals visited while waiting for approvals that never came. Storytelling. Dramatic. The response was not shock that a human being had been killed. The response told you something that no earnings report had ever shown. How much had accumulated? Storytelling. Serious. For how long? In how many waiting room? Storytelling. Serious. In how many phone calls? In how many envelopes that arrived on ordinary Tuesdays with 2 sentences inside? Storytelling. Serious. The most powerful person in American healthcare had become, that morning, the most physically vulnerable. Speaking slowly. Authoritative. The board convened. The stock stabilized. Speaking slowly. Authoritative. A new CEO was appointed. Speaking slowly. Authoritative. The targets did not change. Storytelling. Serious. This is what Level 9 teaches you at the end. The machine does not need you. It needs the position. Storytelling. Authoritative. Whoever stands there, the machine runs on the same logic, because the logic does not live in the CEO, speaking slowly. Serious. It lives above you. Level 10. The Board of Directors / Institutional Shareholders. Speaking slowly. Serious. Your name is not in the news. Storytelling. Authoritative. You did not receive a call when the stock fell 2.3% during the congressional hearing. You received a summary report afterward. Speaking slowly. Calm. You noted the number. You moved on. Storytelling. Serious. You do not read the investigative journalism, not because you lack time. Storytelling. Serious. Because the people who work for you have already synthesized it before it reaches your desk. Speaking slowly. Authoritative. You did not set denial rates. You set shareholder return targets. Storytelling. Serious. In every internal document, in every legal filing, these are described as two separate things. In practice, they are connected by 8 layers of people doing their jobs correctly. Speaking slowly. Authoritative. The CEO must meet your targets. The CMO must support the CEO. Speaking slowly. Serious. The VP of Claims must support the CMO. Medical directors sign the letters. Speaking slowly. Serious. Adjusters process the queue. Processors enter the codes. Speaking slowly. Curious. You have never seen a code. Speaking slowly. Serious. You are a pension fund, a sovereign wealth fund. Storytelling. Authoritative. An index fund. Institutional shareholders collectively hold the majority of stock in all 5 major U.S. health insurers. Storytelling. Authoritative. The people managing those funds have their own fiduciary duties, their own boards, their own return requirements. No individual person made a decision about any specific claim. Storytelling. Serious. The environment in which every claim decision is made was shaped by the aggregate pressure of capital expecting returns. Storytelling. Serious. No one person is responsible. No person was ever in the room where the pressure originated. Speaking slowly. Authoritative. You may sit on multiple boards simultaneously. One insurer. Speaking slowly. Serious. One hospital chain. One pharmaceutical company. Storytelling. Serious. One private equity firm that owns nursing home facilities. This is called a diversified portfolio. Speaking slowly. Serious. No conflict is declared because no single decision connects all of them. Speaking slowly. Authoritative. You are not summoned to congressional hearings. Subpoenas reach CEOs, speaking lowly. Serious. They reach CMOs. Occasionally they reach VPs. Retelling. Authoritative. They do not reach the board. The board has legal counsel that has prepared for the subpoenas that might come. Speaking lowly. Authoritative. The board has fiduciary obligations that create a framework around every decision. Speaking slowly. Serious. You are not the villain of this story. Speaking slowly. Serious. That is the more frightening thing about you. Speaking slowly. Serious. You are not a person making choices. You are the logic that the system runs on. Storytelling. Authoritative. You are the return expectation that makes the target necessary. You are the pressure that makes the benchmark inevitable. Storytelling. Serious. You are the environment in which doing your job correctly at every level below you produces the outcomes that the system produces. Speaking slowly. Serious. Sighs. The person at level 1 does not know you exist. Speaking slowly. Serious. You have never considered the person at level 1. Storytelling. Serious. The machine between you 8 layers deep, hundreds of millions of decisions each year runs exactly as designed. Level 1 does not know Level 10 exists. Level 10 has never heard of a claim number. Storytelling. Serious. Between them, 8 layers of people doing their jobs correctly. 8 layers of incentives carefully constructed so that each decision makes sense at the point where it is made. Storytelling. Authoritative. 8 layers of distance between the person entering the code and the person setting the target. Speaking slowly. Serious. A man made 21 phone calls. Speaking slowly. Serious. The algorithm was updated. Speaking slowly. Authoritative. The quarterly targets were met. Speaking slowly. Serious. The cycle continues. Speaking slowly. Serious. A man made 21 phone calls. Storytelling. Serious. He was trying to find a therapist covered by his insurance. Every number he called. Retired. Speaking slowly. Serious. No longer accepting the plan. 6-month wait list. Speaking slowly. Serious. He never found one. Storytelling. Serious. Meanwhile, on the other side of the system, a physician was reviewing 50 insurance denials every 10 seconds. Speaking slowly. Authoritative. Somewhere above both of them, a board was reviewing a quarterly earnings target. Speaking slowly. Serious. None of these three people knew each other existed. Storytelling. Serious. This is what the health insurance system looks like from every level of the machine. Speaking slowly. Serious. Your life has every rank in